Welcome, 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 and thank you for spending some of your time with us. My name is Tina Rosenquist, and this is Knowledge for Wellness. And this show is to enhance your overall understanding of information provided to you. Because when you know more, you are empowered to make better decisions, to enhance yourself and your loved ones for a better quality of life. And knowledge is power. And today's topic is bringing good health to life. And joining us today is Dr. Kim Lang, a medical doctor. Welcome back.
Thank you, Tina.
I'm
glad
so
to be back.
Yes, thank you. I'm so delighted that you could join us. We've had a great run on this, and to educate my viewers that there is alternative medicine out there, and they have choices. And that's what I want to bring forth to them, because you know, a lot of my viewers are very, very intelligent, and they can make some really great decisions for themselves. So I'm not really sure that they caught the last couple of shows with you.
Mm-hmm.
And I would like you to talk a little bit about yourself. Now, this is your bragging rights, because you did spend quite a few years as a medical doctor, and then you also went into holistic. So that would be great for you to go ahead and tell them about yourself.
Be glad to. I'm a family practice physician, so board certified in family practice. I am also a holistic physician, which is another certification we'll talk more about. And then I'm a homeopath.
Okay.
Although today probably focus on the holistic portion of my practice. There is the American Medical Holistic Association, and they actually have a board that does their own their own testing and education. So it's a separate test that you take every 7 years, whether you want to or not. Same as family practice, actually.
Wow.
Yeah, you think you get done with tests, but never in medicine do we get done with testing.
Yeah,
So
you have to keep proving yourself.
we have to keep proving ourselves and answering A, B, C, or D.
Okay.
Now on computers.
Oh.
So it's funny. But holistic medicine is one of my loves, and it considers the whole person as part of the healing entity. And many people can be holistic, and many people in the healing arts cannot be. If you're holistic, you're going to look at all of the person, not just their heart, not just their gut, not just their great toe, but you'll look at all of that and their family and their life. Some will consider holistic medicine to be body, mind, and spirit as another way to look at it.
Sure. And you're treating the human body as one instead of just looking at the symptom.
Yes.
You're looking at all the variables in their way, they're almost the way they think with their mind. And then, of course, the body, how it can even heal itself, and then the spirit, and to pull it in that you can get better. And that's such a great avenue to.
It is.
And that hasn't really ever been addressed to the degree that we need to complement also the holistic spectrum with actually the Western medicine too. To combine the two and to work together with the actual Western medicine. It seems as if when you go to a doctor, you know, if you were to say that you're going to go to someone holistic, then they'll have something negative to say and think that, you know, what you're doing is wrong. And so that's your choice as the patient to decide if you want to do that. Yeah. And so now we're bringing forth a little bit, another avenue for our viewers to think a little bit outside the box. Yeah, that's great. So my first question, I guess, I just want to talk to you about why would you wish to deal with the illness holistically rather than a usual medical route? And
well, in holistic medicine, since I look at the whole body, my personal experience and professional experience has been that people heal better when you look at all of them. You know, as a family practitioner, even in my residency, that's family practice is basically birth to death.
Right.
But in my residency here in the cities, we actually did a lot of holistic thinking before it was even labeled that.
Oh, okay.
Because we worked with family dynamics, how you were in your life situation, that's part of holistic, your diet, your exercise, all of those pieces. And when those are dealt with, I find people do better. So, and you know, we're in the mecca of holistic medicine. Minnesota, again, is one of the top states in the United States for holism. They look at us. In fact, we've had a group meeting for, maybe 20 years, longer than that, 20 plus, 25, 28 years. We've had a group meeting, and they've actually modeled the rest of the organization, the American Holistic Medical Society, on our way of doing our meetings.
Here in Minnesota, yeah. So they're educating themselves by what we're showing
Yes,
them.
yes.
Great.
So we've gone, our method has gone national because it's worked so well for us. Because we meet probably 3 times a year, and then there's national conventions and things, but we meet 3 times a year here in town, and just all kinds of us, all specialties.
Okay, so we're actually ahead of the game in California, huh?
Yeah, we're ahead more than California. We've been ahead for insurance things before California. I don't know that I'd want to brag about our insurance stuff in HMO, but another topic.
Okay.
We won't go there.
Yeah, we've had some
it's
great
hot.
topics.
Yeah.
We'll compliment ourselves on those.
Yes.
Yeah, that's great. Okay, well, I'll give you an example. For instance, a patient who has ulcerative colitis and wants to recover and to deal with it without the use of prescription medications. So, in your professional opinion, what would you say to them?
Well, ulcerative colitis is one of the inflammatory bowel diseases. And you know, as a medical doctor, we've not had a good handle on those diseases. We're now just coming to think there's probably some allergic reaction or immune reaction, or sensitivity to gluten is one of the thoughts going on. So as a medical doctor, we'd use immunosuppressants, immunomodulators as prescriptions. Some folks don't want to do that because remember, we're really a hollow tube, although we do have 32 plus feet kind of squirrely around in there, but our gut is our biggest, actually, area of immune function. And we don't think of that often, but when you eat food, you need to, your body needs to take in the good stuff and keep the bad stuff, and when it doesn't like the bad stuff, you get diarrhea and vomiting. I mean, it's pretty smart.
Yeah.
We're kind of dumb sometimes because we stop those processes. But anyway, with ulcerative colitis, you'd have a suppressive thing that you do, but you could look at different ways of healing. If you can find a good nutritionist, not the ADA traditional, but someone who actually looks at food sensitivities, that would be a great help for you. An allergist, again, an allergist who looks at food sensitivities. There's a great group in La Crosse that does that, and there's some in the Twin Cities. You might want a naturopath. You know, a naturopath will look at your diet. They actually do a little herbal medicine. They do a little using energies, and they use some homeopathy. That might be an option for you if you don't want to do the allopathic medical doctor route. And as a homeopath, I have over 100 remedies that are about gut.
Oh, okay.
Okay, and I'd want to know, well, is your diarrhea in the morning? Does it wake you up at night? What's the color? Does it stink so bad everybody leaves the room? Or, you know, what are the symptoms? What makes you better? What makes you worse? And then as a homeopath, I can look at that. What's your feeling about your diarrhea? Are you really mad at it? Are you relieved when you have it? Does it make you cry? I mean, all of those fit into a remedy, and that's a whole different way to look at it. So there's really actually several options that you can find doing for ulcerative colitis or bowel disease.
Wow. Because I know the body is trying to heal itself when it actually is doing that, and it's trying to void out, you know, something. And that's what I even told my children when they felt like they were going to throw up. I encouraged it, you know, because then it would void what it needed to at the time. Yeah. So this is great because, you know, you're looking at a person's perception of exactly, you know, so.
What the symptom is it a good symptom? And of course, if you're vomiting for 48 hours straight, which actually we put people through when we put them on chemo.
Yes.
Well, we've had some drugs to suppress that, but the reason you're doing that is your gut's being destroyed because we remake our gut over hours. And so when you stop fast dividing cells, which is what chemo does, then your gut reacts and vomits. So we do all kinds of things.
Yeah.
It's hard to know, and besides, who likes to vomit?
Yeah.
Not too many people I know.
Not at all, yeah. And so now I want to get back to, of course, you know, the mind, spirit, and body. And, you know, some people think, oh my gosh, you know, she's just way out there. But it seems as if, you know, more people are coming to the United States. We're getting more educated on alternative ways. And they're actually proven facts that it does work. And so that's what I kind of want to talk about, how the mind, spirit, and body, and what role, you know, does emotions play in the actual healing.
Oh. I think it's really critical to look. It's part of the holistic looking at people because well, look at someone's situation. If they're at the war and IEDs, the incendiary explosive devices are going off and they're sick in the hospital, how are they going to heal? I mean, how are you going to be comfortable in that situation? Or,
Yeah.
you know, you're the civilian in Iraq or Afghanistan and bombs are coming off. Again, your ability to heal, have a normal life, even as a child, you know, to feel safe.
Yeah.
All of those will affect the ability to be healthy.